Pulmonary edema happens when increased pressure in the blood vessels in your lungs cause them to fill up with fluid, making it hard to breathe. It is often caused by heart disease. The immediate area outside of the small blood vessels in the lungs is occupied by very tiny air sacs called the alveoli. This is where oxygen from the air is picked up by the blood passing by, and carbon dioxide in the blood is passed into the alveoli to be exhaled out. In this video, we're going to discuss respiratory therapy for pulmonary edema, pleural effusion, and other pulmonary diseases. The video is going to be amazing, so make sure you stick to the end. Before starting the video, be sure to smash that like button and subscribe to never miss out on any of our videos. Alveoli normally have a thin wall that allows for this air exchange, and fluids are usually kept out of the alveoli unless these walls lose their integrity. Pulmonary edema occurs when the alveoli fill up with excess fluid seeped out of the blood vessels in the lung instead of the air. This can cause problems with the exchange of gas, oxygen, and carbon dioxide, resulting in breathing difficulty and poor oxygenation of blood. The treatment of hydrostatic pulmonary edema targets a reduction in pulmonary microvascular pressure with diuretics, vasodilators, and sometimes inotropic agents. The treatment of increased permeability pulmonary edema is mainly supportive, mechanical ventilation of patients. With increased permeability, pulmonary edema should be performed with a low tidal volume, lung protective strategy. Respiratory therapy is a specialized healthcare field where practitioners are trained in pulmonary medicine in order to work therapeutically with people suffering from pulmonary disease. A respiratory therapist, RT, is a certified medical professional who specializes in providing healthcare for your lungs. They have advanced knowledge of high-tech equipment such as mechanical ventilators. RTs work alongside doctors and nurses. They practice in many medical facilities, including emergency rooms, maternity wards, and therapy offices. Some RTs care for people in their own homes. Respiratory therapists help improve outcomes for people with asthma, pneumonia, emphysema, lung trauma, and other diagnoses. RTs can assess your breathing, recommend exercises, and monitor your progress. Pleural effusion, also called water on the lung, happens when fluid builds up in the space between your lungs and chest cavity. Thin membranes called pleura cover the outside of the lungs and the inside of the chest cavity. There's always a small amount of fluid within this lining to help lubricate the lungs as they expand within the chest during breathing. However, if too much fluid builds up, for example because of a medical condition, problems can arise. Doctors call this pleural effusion. Pleural effusions can occur when cancer cells spread to the pleura or block the flow of normal fluid within the pleura. Fluid may also build up due to certain cancer treatments such as radiation therapy or chemotherapy. The patient may have unrelated symptoms due to the disease or condition that has caused the effusion. Pleural effusions are very common, with approximately 100,000 cases diagnosed in the United States each year. According to the National Cancer Institute, diuretics and other heart failure medications are used to treat pleural effusion caused by congestive heart failure or other medical causes. A malignant effusion may also require treatment with chemotherapy, radiation therapy, or a medication infusion within the chest. A pleural effusion that is causing respiratory symptoms may be drained using therapeutic thoracocentesis or through a chest tube called tube thoracostomy. In pleural effusion, respiratory therapy may involve a breathing assessment, exercise recommendations, and progress monitoring. For example, if an individual has low oxygen levels, this may signal that the respiratory system is not functioning correctly and that they would benefit from respiratory therapy. In addition, respiratory therapists work with people who have tracheostomy tubes, which allow them to breathe without using their nose or mouth. These professionals also treat people who cannot breathe independently and use a machine called a ventilator that breathes for them. However, they don't only work with individuals who need these high-tech machines. Respiratory therapists also improve outcomes for those of any age with any temporary or chronic respiratory conditions. For example, respiratory therapy for newborns may involve monitoring premature babies for breathing disorders. On the other hand, respiratory therapists may work with older adults who have acute or chronic diseases affecting the respiratory system. RPE appears to be due to increased permeability of the pulmonary vasculature in both experimental animals and humans. The edema fluid has a high protein content, suggesting that edema forms because of the increased capillary leak rather than increased hydrostatic pressure. It has been hypothesized that the mechanical stresses applied to the lung during re-expansion damage the capillaries and lead to pulmonary edema. Reperfusion injury due to reactive oxygen species is another possibility. Moreover, neutrophil depletion doesn't affect the amount of edema. For these reasons, mechanical stress on the lung is currently considered to be the most likely cause of RPE. In humans, most cases of RPE develop when the pneumothorax or pleural effusion has been present for at least 3 days and when negative pressure has been applied to the pleural space. Pulmonary edema is a common complication of atherosclerotic coronary artery disease. As the blood vessels that supply nutrients to the heart tissue progressively narrow, the heart muscle may not receive enough oxygen and nutrients to pump efficiently and adequately. Pulmonary edema is typically diagnosed by a chest X-ray. A normal chest radiograph X-ray consists of a central white area pertaining to the heart and its main blood vessels, plus the bones of the vertebral column, with the lung fields showing as darker fields as either side. Enclosed by the bony structures of the chest wall, a typical chest X-ray with pulmonary edema may show a more white appearance over both lung fields than usual. More severe cases of pulmonary edema can demonstrate significant opacification, whitening over the lungs with minimal visualization of the normal lung fields. This whitening represents the filling of the alveoli as a result of pulmonary edema, but it may give minimal information about the possible underlying cause. To identify the cause of pulmonary edema, a thorough assessment of the patient's clinical picture is essential. A careful medical history and physical examination often provide invaluable information regarding the cause. Acute pulmonary edema is a medical emergency that requires immediate management. It's characterized by dyspnea and hypoxia secondary to fluid accumulation in the lungs, which impairs gas exchange and lung compliance. The 1-year mortality rate for patients admitted to hospital with acute pulmonary edema is up to 40%. The most common causes of acute pulmonary edema include myocardial ischemia, arrhythmias, example atrial fibrillation, acute valvular dysfunction, and fluid overload. Other causes include pulmonary embolism, anemia, and renal artery stenosis. Non-adherence to treatment and adverse drug effects can also precipitate pulmonary edema. Pulmonary edema should be treated with conventional medications. Complementary and alternative therapies may be used with your doctor's permission, helping to strengthen your heart and lungs, but they should never be used by themselves to treat pulmonary edema. Make sure you tell your doctors about any CAM therapies or supplements you may be using. Depending on what kind of diuretic you take, you may need to get more potassium and magnesium in your diet. For example, by eating bananas, apricots, nuts, seeds, and green leafy vegetables. Your doctors may also suggest that you take a supplement. With other kinds of diuretics, you may need to make sure you don't get too much of potassium. Ask your doctor if you need more magnesium and potassium, or if you need to make other changes to your diet. Sometimes respiratory therapy can help increase breathing efficiency for older people. Respiratory tract infections, chronic obstructive pulmonary disease, and bronchial pneumonia are diseases that a person over the age of 65 is likely to encounter. Geriatric respiratory therapy happens at a hospital, an outpatient facility, and a person's home. Adults over 65 and adults who smoke are the people that need RTs most. Premature babies often receive care from RTs as well. Critical care respiratory therapy occurs in a hospital. It can involve treating people in the emergency room or those recovering from heart surgery or lung failure. Sometimes complicated surgical procedures require the assistance of a respiratory therapist to ensure that the lungs function throughout and after the surgery. Although these machines can be life-saving, placing someone on a ventilator too late or keeping them on for longer than necessary can cause severe complications. In addition, they should understand the stress that everyone faces when coping with a loved one experiencing health problems. Therefore, respiratory therapists carefully monitor their patients to ensure that they're providing optimal care. When choosing a respiratory therapist, it's important to opt for someone patient and compassionate, as they need to provide emotional support to both the individual requiring care and those close to them. In addition, they should understand the stress that everyone faces when coping with a loved one experiencing health problems. It's also ideal to find someone with a passion for learning, as respiratory therapy is a field that is continually expanding and improving. A therapist who keeps abreast of current best practices is likely to know how to provide optimal care. So ask your doctor if you need more magnesium and potassium. Depending on what kind of diuretic you take, you may need to get more potassium and magnesium in your diet. Pulmonary edema should be treated with conventional medications. Complementary and alternative therapies may be used with your doctor's permission, helping to strengthen your heart and lungs. Let us know your opinion in the comment section down below. This is all for today. Hope you liked the video. Don't forget to subscribe to our YouTube channel. Stay safe, and we'll be back soon with another video. Please click on the next video clip to watch for more health info. Thank you very much.